So what is a spinal segment then? The length of the spinal cord over a certain length of spinal cord the rootlets giving origin to single spinal nerve. Again, I'm repeating, the rootlets giving origin to one spinal nerve. These rootlets for that spinal nerve constitute spinal segment for that spinal nerve. So that spinal cord is made up of 31 such segments. In the region, cervical region, we have 8 segments. In the thorax, we have 12 segments. In the lumbar region, we have 5. And then further down, we have 5 sacral and 1 coccygeal. I would like all of you to pay attention to this diagram on the right side of the slide. We know from our previous lecture that in the adults, the spinal cord ends at the lower border of the L1 or between first lumbar vertebra and second lumbar vertebra. Because of this termination of the spinal cord at such a higher level, upper lumbar level, you can see the lower segments, especially the lumbar and sacral and coccygeal, they are shortened, they are compressed to be short so that spinal cord could end at the L1, L2 lumbar vertebral level. So this was about the spinal segment. So what is a spinal segment? Rootlets that give rise to 2 roots which unite to form a single spinal nerve. Rootlets of these roots for that spinal nerve, they constitute the segment, spinal segment of that spinal nerve. So that we know on one side of the vertebral column, there are 31 spinal nerves, and on both sides, we have 31 spinal nerve pairs. What does it mean? It means there are going to be how many segments? 31 segments. We have 8 cervical spinal nerves, hence we have 8 cervical segments. We have 12 thoracic spinal nerves, hence we have 12 thoracic spinal segments. We have 5 lumbar spinal nerves, and for them we have 5 lumbar spinal segments. For the sacrum, we have 5 sacral spinal nerves, and for them we have 5 sacral spinal cord segments. 1 coccygeal and 1 coccygeal spinal cord segment. Because of this compression at the lower regions of the spinal cord in the sacral and the coccygeal levels, because of this compression, so that spinal cord in the adults could end at the lower border of the first lumbar vertebra. The spinal nerves arising from the sacral and coccygeal segments, they give rise to an appearance which resembles the tail of a horse, which we studied in our first lecture, is called cauda equina. So I hope this point is clear to you. Next, moving on to the vertebral levels of these spinal segments. Vertebral levels of the spinal cord segments. Now, what does it mean? Again, recall your knowledge from the last lecture. We studied that each spinal nerve arising from its own segment. How does it exit the vertebral column? Through its corresponding intervertebral foramen. Except at a few levels where the spinal nerves, especially in the lower parts or in lower segments of the spinal cord, where the nerves are forming cauda equina, they have to go down obliquely in order to exit their intervertebral through their intervertebral foramina. So let's compare the vertebral levels with the spinal cord segment. What is their relationship with each other? What is their relationship with each other? Okay, fine. Let's start with the upper cervical. And also take it as an example. Here I'm talking about second cervical vertebra. Okay. At the level of the second cervical vertebra, we have which segment of the spinal cord? Second cervical segment. So they are lying in correspondence to each other. Okay. What about in the lower cervical regions? For fifth, at the level of the fifth cervical vertebra, we have which segment from the spinal cord? Sixth cervical segment. So we have one vertebra above a spinal segment. I hope you have understood this point. Let me repeat. In the upper cervical regions, at the level of second vertebra, cervical vertebra, we have second cervical spinal segment lying at the level of second cervical vertebra. But in the lower cervical regions, for example, we have sixth spinal cord segment lying at the level of the one vertebra above, that is fifth cervical vertebra. I hope this point is clear to everybody. Let's compare the levels of the spinal cord segment in the thoracic region. Upper thorax, what happens is that fifth thoracic spinal cord segment lies at the level of the two vertebra above it, that is third thoracic vertebra. Lower thoracic regions, we have 10th thoracic spinal segment lying 3 vertebra above, that is 7th thoracic vertebra. Look at the lumbar region. We have all the lumbar segments L1 to L5 lying at the level of 10th to 11th thoracic vertebra. Now here you can understand from the, especially from the lower regions, that how the spinal cord is compressing into the segments above each other in order to end the spinal cord at the level of which vertebra? First, lumbar vertebra. So now we have sacral and coccygeal spinal segments of the spinal cord finally lying at the level of 12th thoracic vertebra and first lumbar vertebra, where spinal cord in the adults is supposed to end. I hope this topic is clear to you, the vertebral levels and their corresponding spinal cord segments. If not, then now, why do you have to know the level of these spinal segments in relation to their vertebral column levels? Because of their clinical importance. Why? Because you may receive a patient with vertebral column injury. So, by looking at the level of the vertebral column injury, you should be able to assess the injury or disease that may involve the spinal cord segment in relation to the vertebral column level injury. So I hope this point is clear to everybody. Now let's look at the exit of the spinal nerves. What should you know about the exit of the spinal nerves? We know from our previous knowledge that each spinal nerve exits through intervertebral foramen. So what do you have to know about it? You have to know the level of their exit. And what is that level? Because we have a few exceptions to this rule. Cervical nerves, they exit above their corresponding vertebra. Cranial nerves, cervical spinal nerves, they exit above the corresponding vertebra, their corresponding vertebra, except eighth cervical nerve, which exits between which vertebrae? Seventh cervical vertebra and first thoracic vertebra. Rest of the spinal nerves, that is starting from first thoracic spinal nerve, they exit below their corresponding vertebrae. So I hope this point is clear to you. Why is it that cervical nerves are exiting above their corresponding vertebra, whereas remaining nerves are exiting below their corresponding vertebra, except a cervical nerve? We know that first cervical spinal nerve exits between the first cervical vertebra, which is also called atlas vertebra. So this first cervical spinal nerve exits the vertebral column between base of the skull and atlas vertebra, or the first cervical vertebra. Eighth cervical nerve exits below the seventh cervical vertebra and above the first thoracic vertebra. Why? Because we know there are only 7 cervical vertebrae in the cervical region of the vertebral column. There is no 8th cervical vertebra. This is why 8th cervical nerve is going to exit between the 7th cervical vertebra and first thoracic vertebra. And because of that, thoracic spinal nerves are going to exit below their corresponding thoracic vertebrae till coccygeal spinal nerve. I hope this point is clear to everybody. Now let's move on to the very important topic. So starting with the development of the segmental innervation, dermatome. What is a dermatome? How do you define dermatome? Dermatome involves an area of skin, derma referring to skin. Derma refers to skin. So areas of the skin supplied by individual spinal nerves are called dermatomes. And to understand them fully, you must know some facts related with their development. During the development, the upper limb and lower limbs, they develop from the limb buds. Here you can see the development of limb buds, both upper limb buds and lower limb buds. Here is another picture showing further development in the fetus during the intra-embryonic life. Look closely at these two diagrams. On the left side, A and B. Limb buds for both upper limb and lower limb, they are, during their development, in the beginning, they are first directed forwards and laterally. from the body of the embryo. So that each bud has a cranial border called preaxial border and a lower border which is called postaxial border. Similar is the case with the lower limb bud. This is why thumb and the great toe in the upper limb and lower limb, they are formed on the preaxial border, which is also called cranial border, which is also going to be labeled later as lateral border. This is why thumb and big toe are located laterally. You can see the forelimb bud is located opposite to what spinal segment? C3, C4, C5, C6 up till T2, second thoracic spinal nerve segment. Look at the lower limb bud, hind limb bud. It lies opposite the levels of the L2 to L5 and S1 to S3. So that during the development, these spinal segments, they are being pulled away by the developing limbs, hence deriving their sensory nerve supply along with them. Similar is the case with the myotomes. Myome refers to muscle, the spinal nerve supplying the muscles. Similar is the case, more or less is the case with the development of the myotomes. Muscles during their development, they pull their spinal nerve along with them. But they are not as defined per segment as most of the dermatomes are. Their segmental innervation is more defined as compared to myotomes. So betas, some of the facts, I'm going to get some speed because I'm running out of time on Zoom. So you need to remember this slide, okay? I hope this is clear to you, the concept of dermatome and myotome. Also look at the overlapping of these dermatomes. Because of this overlapping, an area of skin may receive sensations from the multiple nerves. Similar is the case with the myotomes. So here is the mapping of dermatomes, body map for dermatomes and body map for the myotomes. Moving on to the spinal reflexes. What is a reflex, first of all? A reflex may be defined as an immediate and involuntary response to a stimulus. A reflex is a fast response to a change in the body's internal and external environment in an attempt to restore homeostasis.